slide off of each other, and the only way to put it back is to actually lift it and reposition it in the right anatomical layer, right along where that layer is. So that's one way. And then the second thing that happens, these are independent of each other. One thing doesn't fix the other. A facelift doesn't fix the empty cheek. You can't lift the empty back. So, so the next thing is loss of volume, and it's not just fat, it's bone too. And people say, well, why don't I just put fat in there? Well, fat has its benefit, but it also has its disadvantages. It's unpredictable. You don't know how much the fat will survive. You don't know if you gain 5 pounds, will that fat also get bigger and now your lips look huge? I've seen that. I'm not just saying that. So everything we do has its risk, but when it comes to the fillers, at least the fillers that her company has, which are the only ones I use, you have some safety net behind you. If you don't like it, you can dissolve it away. If you want more, you can always add. And we also start with a conservative approach. We don't push somebody to have so much, but at the same time, you don't want to do so little that you don't see the magnitude of the result. I used to do too little because I always worry about my patient's pocketbook. And one patient one time after Christine came in, he's like, Dr. Farzaneh, I told you I could have used 2 Mercer Rangers. And she's still appreciative that I was watching out for her, but she also, I realized that, hey, I was wrong. She wanted that result, and I didn't give it to her for 3 years. So there's a little bit of both things that you have to understand, and we understand everybody's wanting to do it, nobody needs it, but it does make a difference. So we're addressing one component of aging, which is empty, loss of volume. That's what fillers do. And sometimes it's an illusion. Sometimes, for this area, we can't really fill it up. We can't lift up the jowl area, but just filling it a little bit makes it look like it's fuller. So those things we try to be a little bit more, we don't try to solve the whole problem. We just try to make it look better. Or like people who may need a facelift, but they have a little jowling here, so there's hollowness behind it. Sometimes you can put a filler behind it and make it look more like a straight line. This is just playing with, lines and curves, and it's an illusion. But if it helps you avoid a, $10,500 facelift for a little while, it's worth it.